Test.com's Medical Billing Practice Test. For complete practice, check out our Medical Billing Practice Exam with 500 questions and fully explained answers. Types of insurance. Question 1. TRICARE is insurance for A. Active duty military and their families. B. Surviving spouses of military service members. C. Retired service members. D. All of the above. D. All of the above. TRICARE covers active duty service members and their families, and also surviving spouses and retired active duty service members under certain plans. Question 2. Betty Jane has Medicare coverage. You explain to her that she cannot come to see Dr. Frank at the outpatient clinic for a simple skin cancer removal because she A. Only has Medicare Part A. B. Only has Medicare Part B. C. Medicare does not cover outpatient clinics. D. Her diagnosis does not meet medical necessity. A. Only has Medicare Part A. Medicare only covers inpatient hospital stays under Medicare Part A, and additional coverage must be purchased for Medicare Part B, which would cover an outpatient and physician office visit. Question 3. Farah has Medigap and pays out of pocket for this coverage. Which of the following will this plan cover? A. Hospital stays. B. Long-term care. C. Glasses. D. Dental care. A. Hospital stays. Medigap only covers what original Medicare covers, but will cover deductibles, copays, and coinsurance. Medigap does not cover prescription drugs or anything else that traditional Medicare does not cover. Question 4. Medicaid is administered by A. State governments. B. Federal government. C. Private companies. D. Nonprofit organizations. A. State governments. Medicaid is administered by the state governments in accordance with federal requirements and is for low-income, disabled, or individuals with complex medical needs, and has a subsection for a children's insurance plan in some states. Question 5. Which of the following is not a private insurance carrier? A. Cigna. B. Aetna. C. United Healthcare. D. CMS. D. CMS. CMS is Centers for Medicare and Medicaid, which is run by the government and not private insurance. Question 6. A patient comes in with a piece of metal shavings in his eye that he got while welding at his job. He has Anthem health insurance through his work. Which of the following insurances would cover his visit? A. Medicaid. B. Anthem. C. Workers' compensation. D. Disability insurance. C. Workers' compensation. The worker patient must fill out a workers' compensation claim. His private insurance will not cover a work-based injury. The insurance company will be notified because there is a specific box on the CMS 1500 form that asks whether this injury was related to work. Question 7. The difference between an HMO and a PPO is A. HMOs cost less but provide better care. B. PPO plans allow patients to be seen out of network at an increased cost, while HMOs do not. C. HMO plans allow patients to be seen out of network at an increased cost, while PPOs do not. D. There is no difference between HMOs and PPOs. B. PPO plans allow patients to be seen out of network at an increased cost, while HMOs do not. PPO plans cover out-of-network visits, but usually at a significantly reduced rate, e.g. 50% coverage instead of 80%. HMO plans do not allow for visits out of network. Medical billing regulations. The time allowed to submit a claim to Medicare is A. 365 days. B. 180 days. C. 120 days. D. 90 days. A. 365 days. 365 days, or 1 year, is timely filing for Medicare. Other insurances, such as Humana, have shorter timely filing periods of 90 days. Claims can be submitted to Medicare after 1 year, but will be denied for timely filing limit and no payment will be received. Question 9. A patient has medical coverage through IHS. To which of the following organizations would you most likely submit a claim? A. Muskogee Nation Health System. B. Blue Cross Blue Shield. C. United Healthcare. D. St. Marcus Health System. A. Muskogee Nation Health System. The Muskogee Nation Health System is part of the Indian Health Service, IHS. Patients who have IHS coverage will have their claim often submitted directly to the tribe for payment. Question 10. Which act mandates the provision of emergency medical treatment in order to stabilize the patient even if the patient cannot pay for it? A. ACA. B. ARRA. C. EDTA. D. EMTALA. D. EMTALA. Emergency Medical Treatment and Active Labor Act, EMTALA, requires hospitals to provide emergency medical treatment to individuals regardless of their insurance status or ability to pay. It ensures that emergency services are provided during critical situations without financial discrimination. However, it only provides enough coverage to stabilize the patient. Question 11. Which of the following regulations prohibits billing of invalid claims to government payers only? A. Payment Protection Program, PPP. B. False Claims Act, FCA. C. Anti-Kickback Statute. D. Stark Law. B. False Claims Act, FCA. The False Claims Act imposes criminal penalties for falsely submitted claims to government payers. It does not cover commercial payers, only payers that receive money from the federal government. Penalties can be severe and may result in millions of dollars of fines or even jail time. Question 12. Which of the following changes would be considered a criminal offense in medical billing? A. Raising the price of the usual and customary fee across all payers. B. A coder switching an EM code from 99213 to 99214. C. Writing off BCBS copays after 3 years of non-payment. D. Adding a modifier to a claim to a bilateral code to get both sides paid. D. Adding a modifier to a claim to a bilateral code to get both sides paid. Bilateral codes are inherently two-sided. Adding a modifier to the code to get two bilateral codes paid for the same procedure would be a false claim and subject to possible criminal penalties. Question 13. What is the main objective of the Medicare Access and CHIP Reauthorization Act, MACRA? A. To eliminate the use of Social Security numbers in Medicare. B. To provide health insurance for children under the CHIP program. C. To change the way Medicare rewards clinicians for value over volume. D. To expand Medicare coverage for young children. C. To change the way Medicare rewards clinicians for value over volume. MACRA changes how Medicare Part B providers are paid, shifting the focus from a fee-for-service model to a value-based care model, where providers are rewarded based on the quality and effectiveness of the care they provide. Question 14. Under which law are out-of-network providers prohibited from balance billing patients for radiology fees? A. Administrative Simplification Act. B. Affordable Care Act. C. No Surprises Act. D. Merit-Based Incentive Payment System. C. No Surprises Act. The purpose of the No Surprises Act is to give protection to patients for unexpected medical bills, in particular, out-of-network providers in emergency situations, or at in-network facilities without the patient giving consent. This act restricts excessive out-of-pocket costs to patients from surprise billing. This only applies to certain provider types like radiology, ambulance, and laboratory. Question 15. The amount a provider charges the insurance company for services A. Varies depending on how much the insurance reimburses for that procedure. B. Must be a set amount per procedure for all insurance carriers. C. Must be a set amount for each particular insurance carrier. D. Can change depending on how complex the procedure was. B. Must be a set amount per procedure for all insurance carriers. A usual and customary amount, U&C, must be set and charged the same amount to all insurance carriers. The U&C amount can change and should be set to higher than the highest paying insurance company in order to capture complete reimbursement. Question 16. According to CMS, which form must be obtained and signed for Medicare beneficiaries receiving non-covered services before those services are rendered? A. CMS 1500. B. ABB. C. NBN. D. ABN. D. ABN. An Advance Beneficiary Notice, ABN, must be filled out before a patient receives non-covered services. This form must include a breakdown of all costs and the reason why it will not be covered. CMS 1500 is used to submit claims and beneficiaries never see it. Question 17. Marge has Medicaid and goes to see the chiropractor once a week. The chiropractor takes Medicaid, but informs Marge that she has a $25 copay for each visit. Marge's insurance card lists no copay. When questioned, the billing office tells Marge that her insurance company only reimburses $17 per chiropractic visit, and it would cost them more to bill her insurance than it would to just have her pay, and it's only $25. According to Medicaid regulations, A. It is illegal to bill Medicaid patients without signed consent. B. It is illegal to bill Medicaid patients before billing Medicaid first. C. Marge should call Medicaid to see if her copay has changed. D. Marge should ask to pay $17 per visit. A. It is illegal to bill Medicaid patients without signed consent. It is illegal to bill Medicaid patients without signed consent. The chiropractor should refund her money and bill her insurance properly. Even if a service is not covered when billed to Medicaid, the balance cannot be billed to the patient afterwards. Question 18. A Medicare patient calls. She's been seeing Dr. Hamilton for 10 years for her chronic conditions. It's January and her furnace just broke and will be $500, and she's on a fixed income and just can't swing the furnace and her Medicare deductible right now. She's going to have to make payments on the furnace as it is. She wants to know if there's any way you could give her a break and waive the deductible. How should the billing professional respond? A. Sorry, you cannot waive the deductible. B. You must come in and fill out a financial hardship form. C. You have to make payments, but you have 3 months to pay per company policy. D. I'll speak to Dr. Hamilton and see if there isn't anything that can be done to help you. B. You must come in and fill out a financial hardship form. According to the OIG, you may waive the patient's deductible for Medicare if the patient demonstrates financial hardship. You must keep a record of this form in the patient's records. HIPAA and compliance. Question 19. Your neighbor's 17-year-old daughter was recently admitted to the hospital where you work in the billing department. The nurse told you that she's asleep and your neighbor is out of town. But you are curious what treatments she has received and want to make sure that she told the provider she is allergic to latex. What do you do? A. Ask your neighbor. B. Just pull up her chart in the EHR so you do not bother anyone. C. Ask the nurse to let you know how her treatment is progressing. D. Update the chart to reflect that your neighbor is allergic to latex. A. Ask your neighbor. Accessing your neighbor's daughter's information in the EHR violates HIPAA's minimum necessary requirement, where individuals only access the minimum amount of protected health information needed to do their job. In instances where this is a break the glass safety feature in your hospital's EHR, This may send an alert to compliance and you will be subject to discipline or a more serious employment action. Question 20. A Medicare RAC sends you a letter demanding that you repay Medicare $1,500 for 10 patient accounts. You must A. Repay the RAC within 10 days. B. Send the RAC a letter stating why you cannot pay right now. C. Do nothing and let CMS take their money back as they please. D. Either A or B. C. Do nothing and let CMS take their money back as they please. You do not actually have to do anything. You can refute the RAC letter and provide documentation, file an appeal, or do nothing, and the RAC will recoup their payments out of your next check from Medicare. Question 21. What does the acronym HIPAA stand for? A. Health Insurance Probability and Accountability Act. B. Health Insurance Portability and Accountability Act. C. Health Insurance Privacy and Accountability Act. D. Health Information Privacy and Accountability Act. B. Health Insurance Portability and Accountability Act. HIPAA stands for Health Insurance Portability and Accountability Act. It was enacted in 1996 to protect individuals' health information while allowing the appropriate release health information needed to provide high-quality health care. Its latest revision was in 2002. Question 22. Which part of HIPAA is primarily focused on protecting the privacy and security of health information? A. Insurance reform. B. Administrative simplification. C. Tax-related health provisions. D. Application and enforcement of group health plan requirements. B. Administrative simplification. Administrative simplification sets national standards for electronic healthcare transactions and national identifiers for providers, health insurance plans, and employers. It also includes the privacy rule and security rule, which protect the confidentiality and integrity of health information. Question 23. The information of what number of patients must be improperly disclosed before the healthcare organization is required to contact the local news media. A. 5. B. 50. C. 500. D. 5,000. C. 500. According to the breach notification section of HIPAA, if 500 or more patients are exposed to a breach of their private information, the local news media must be contacted. Anything less than that would require the healthcare organization to report the breach to the Secretary of Health and Human Services. Question 24. A patient calls and asks that you send them their chart for their most recent visit. How much time do you have to send them their records? A. 5 days. B. 7 days. C. 10 days. D. 30 days. D. 30 days. Under the privacy rule, HIPAA allows for 30 days, and an additional 30 days can be added to the time period if you inform the patient in writing. Reimbursement and collections. Question 25. A provider bills $400 for a test. The insurance pays $300, and the patient's responsibility is $23.56. What is the contractual discount, and what is the patient's responsibility called? A. $100 copay. B. $76.44 coinsurance. C. $100 coinsurance. D. $76.44 copay. B. $76.44 coinsurance. Coinsurance is a percentage of the contractual allowance, while copays are a flat set amount. The contractual allowance is the amount the provider was reimbursed directly plus the patient's responsibility, so the contractual discount is the usual and customary amount, UNC, minus reimbursement and minus patient's responsibility. For complete practice, check out our medical billing practice exam with 500 questions and fully explained answers. Question 26. Capitation payments in healthcare are A. payments made per service or procedure. B. Fixed monthly payments made to a provider for each patient enrolled under their care. C. Bonuses paid to providers for reducing healthcare costs. D. Penalties for overutilization of healthcare services. B. Fixed monthly payments made to a provider for each patient enrolled under their care. Capitation is a way for healthcare service providers to be paid. For each enrolled person under this system, physicians are paid a set amount per period of time, whether or not that person seeks care. Question 27. Which is a case mix index? A. The ratio of male to female patients in a healthcare facility. B. The distribution of healthcare providers to patients in a given area. C. The variety of different types of health insurance that patients have within a healthcare provider's patient population. D. A description of the weight of diagnoses that patients have across the facility. D. A description of the weight of diagnoses that patients have across the facility. A case mix index is the average diagnoses-related group, DRG, weight for a facility. It is created by adding all the weights of each patient's DRG and dividing it by the number of patients. This indicates the average monthly payment that a hospital or facility can receive so they can plan financially. Question 28. Per diem codes are reimbursed by A. Day, B. Unit, C. Patient, D. Session. A. Day. Per diem codes are reimbursed per day. Some examples of per diem codes include partial hospitalization psychiatric codes and some skilled nursing facility codes. Question 29. What is a clearinghouse and what purpose do they serve? A. Clearinghouses collect patient data in a centralized location to promote interoperability in emergency situations. B. Clearinghouses distribute payments to providers from third-party payers. C. Clearinghouses act as an intermediary between insurances and providers to submit electronic claims. D. Clearinghouses provide collection services for patients who have not paid their bill. C. Clearinghouses act as intermediary between insurances and providers to submit electronic claims. Clearinghouses collect claims data and send it in a lump file to each individual insurance for reimbursement. Clearinghouses also receive and distribute ERAs and can provide additional services, such as patient statements if requested, but do not provide collection services. Question 30. A blank is a monthly payment to purchase and continue insurance coverage. A blank is how much money you must pay before your insurance begins to pay for medical services. A blank is a flat fee you must pay every time you see the doctor, and blank is a percentage you must pay in addition to other fees. A. Deductible, premium, coinsurance, copay. B. Premium, deductible, copay, coinsurance. C. Premium, copay, deductible, coinsurance. D. Copay, coinsurance, deductible, premium. B. Premium, deductible, copay, coinsurance. Premiums are paid monthly to insurance to continue coverage. Deductibles must be paid before insurance begins to pay for medical services. Copays are flat fees for each doctor's visit, and coinsurance is a percentage of the allowed amount that must be paid in addition to copays and deductibles. Question 31. You are reading a Medicare RA. You see that Medicare has allowed the full amount but paid nothing. The total amount is $145. The Claims Adjustment Reason Code reads CO1. What do you do? A. Call Medicare because they didn't pay. B. Contact coding and see if they can fix the claim. C. Send the patient a bill. D. Submit the claim again with a modifier. C. Send the patient a bill. CO1 means that the patient has not paid their deductible, so the allowed amount should be transferred to the patient for them to pay. Question 32. What is a RVU and why is it important? A. Resource Value Unit. It determines how much work goes into each procedure code. B. reimbursement value unit. It determines groups of similar procedures that are paid similarly. C. Reimbursement Vantage unit. It determines how weighty a procedure is and how it gets reimbursed. D. Relative value unit. RVUs are based on practice costs, physician's work, and malpractice insurance and determine fee schedules. D. Relative value unit. RVUs are based on practice costs, physician work, and malpractice insurance and determine fee schedules. Relative value units are combined with GPCIs and conversion factors to create the Medicare fee-for-service fee schedule. Medical billing. Question 33. A patient has cataract surgery, which has a 90-day global period. The patient's date of surgery was 1/1, and their date of transfer was 1/2. If you are billing CMS for post-operative care only, what dates must you put in which box? A. 1/1 through 4/1 in box 19. B. 1/2 through 4/2 in box 19. C. 1/1 through 4/2 in box 17. D. 1/2 through 4/2 in box 17. B. 1/2 through 4/2 in box 19. Medicare requires date of transfer, not date of surgery, as the beginning of the post-operative period. This information goes in box 19. Question 34. If you are submitting a corrected claim, you must do the following. A. Use code 7 in box 22 with an ICN. B. Write corrected claim in box 19. C. Put the original claim number in box 23 and write corrected claim in box 19. D. Only use a paper claim so you can write corrected claim in big letters on the top. A. Use code 7 in box 22 with an ICN. Use code 7 for replacement claims and use the original claim number, ICN, in that box. Question 35. Sarah bills for the outpatient department for a hospital, where they are paid under the outpatient prospective payment system. Sarah reviews a patient's account to begin the billing process and sees an emergency department visit that includes lab work, an EKG, IV medication, and a simple surgery. Which item will not be reimbursed if Sarah bills for it? A. Emergency department visit evaluation and management code. B. Lab work. C. Simple surgery. D. IV medication. B. Lab work. Lab work is considered bundled under the outpatient prospective payment system when ordered in the emergency department. All other items, the evaluation and management code, the surgery, and IV medication may be separately payable with the proper codes. Question 36. Daphne works at a doctor's office and submits a claim for an office visit for postpartum complications right after the patient has given birth. What is the most likely reason for this claim being denied? A. Daphne did not use an appropriate modifier. B. The wrong diagnosis was used. C. The office visit is included in the global period postpartum. D. The hospital must bill for this office visit. C. The office visit is included in the global period postpartum. Postpartum visits have a 42-day postpartum global period, so no office visits relating to the patient's pregnancy may be billed. The patient needs to continue to see their OBGYN for continuity of care. Question 37. In EMC ANSI 837, what are the boxes that were on the CMS 1500 now called? A. Section and areas. B. Loops and segments. C. Squares and crofts. D. Sections and segments. B. Loops and segments. Loops and segments crosswalk to CMS 1500 boxes. Question 38. If the information on CMS 1500 in 24J is the same individual as the information in 32A, what is the most likely cause? A. It is a mistake that you need to call credentialing about. B. The provider's NPI is wrong in 24J. C. The provider is enrolled as a sole proprietor and only has an individual NPI. D. The provider makes home visits. C. The provider is enrolled as a sole proprietor and only has an individual NPI. The provider is enrolled as a sole proprietor and only has an individual NPI. Sole proprietors can use their individual NPI as both a group and an individual NPI, but if they ever hire someone, it makes billing a bit messy. The group could also be put into box 24J, but since we're talking about individuals and not organizations, this is not the most likely cause. Question 39. If a patient has both Medicare and Aetna, which insurance do you bill? A. Medicare first, then Aetna. Medicare will send an RA to Aetna for COB. B. Aetna first, then Medicare, because private insurance should always be billed first. C. Determine which insurance is primary and bill that first. D. Check the patient's insurance card for instructions. A. Medicare first, then Aetna. Medicare will send an RA to Aetna for COB. Medicare is always primary, and Medicare will send an RA to Aetna, which may or may not make it, so it's always good to follow up with another claim and COB to Aetna after receiving your remit from Medicare. Question 40. What is a valid POS for an office? A. Downtown. B. 11. C. In a hospital. D. 12. B. 11. 11 is the place of service, POS, that is billed for an office. 12 POS is a home visit. Medical coding. Question 41. When using a 50 modifier on a claim instead of using RT and LT on a claim, remember that A. Anatomical modifiers are payment modifiers. B. RT and LT increase payment by 150%. C. A 50 modifier is a payment modifier. D. A 50 modifier requires RT and LT to be billed. C. A 50 modifier is a payment modifier. A 50 modifier is a payment modifier. RT and LT codes are informational only and are not required to be billed with a 50 modifier. RT and LT codes are used when a unilateral code is billed to indicate it was done on more than one side and do not affect the payment of the code. 50 modifiers, however, increase reimbursement by 150% for a single line of code. Question 42. Which of the following is true about code J4010? A. It is not a valid code. B. It is a Category 3 code. C. It is an anesthesia code. D. It is a drug code. D. It is a drug code. J4010 is a drug code. All drugs are included in the HCPCS Level 2 under the J section and can be found by the table in the front of the HCPCS Level 2 book. Question 43. Which of the following codes are most likely to be not included in a code for an arm fracture reduction surgery? A. General anesthesia. B. Debridement. C. Lidocaine. D. Cast application. A. General anesthesia. Per CMS NCCI policy, anesthesia is not covered as part of a fracture reduction. However, casting of the arm, lidocaine for pain, and debridement of bone fragments are all included in the surgical procedure. Question 44. Dr. Smith sees a child patient for 15 minutes, then speaks to their parent for 45 minutes, carefully detailing instructions for the child's care. If Dr. Smith is in an office, which code would be used for this service? A. 99417. B. 99215. C. 99214. D. 99358. A. 99417. EM guidelines indicate to use 99417 when an evaluation and management service exceeds 55 minutes. Here, when speaking to the patient's caregiver, we can include that time in the leveling of the service. Question 45. If a distinct evaluation and management service is billed with an injection, what modifier must be attached? A. 25 attached to the injection. B. 59 attached to the injection. C. 59 attached to the evaluation and management service. D. 25 attached to the evaluation and management service. D. 25 attached to the evaluation and management service. A 25 modifier must be attached to the evaluation and management if documentation supports and it was a significant and separate service apart from the injection. Question 46. A patient gets blood work done. They receive blood work that tests CMP, albumin, urea, potassium, chloride, creatinine, and glucose. Everything but the CMP is denied. Why? A. CMP includes all other tests. B. Those tests aren't reimbursable at your facility. C. You need a modifier on the tests to indicate they were part of a different blood panel. D. The provider was incorrect and should have been billed under the facility instead of the doctor. A. CMP includes all the other tests. Comprehensive metabolic panel includes albumin, bilirubin, calcium, carbon dioxide chloride, creatinine, glucose, phosphatase, potassium, protein, sodium, ALT, AST, BUN. This is an example of unbundling. Question 47. A patient comes in for a consultation on back pain and ends up scheduling the surgery for next week. What modifier should be added to the evaluation and management service? A. 26, B. 57, C. 54, D. 59. B. 57. Modifier 57 indicates that the evaluation and management service resulted in a decision for surgery. Question 48. A patient comes in for a follow-up on their dressing. 3 days before, the patient had an incision and drainage of a hematoma from their wrist, which was paid by the insurance. The follow-up visit was denied. Why? A. The follow-up procedure should have a modifier 24 to be paid. B. The diagnosis code was most likely wrong. It needs to reflect postoperative care. C. The procedure has a 90-day global period and covers all related services within 90 days, so this will not be paid. D. The provider needed a referral for the follow-up visit since it was a different person applying dressings. C. The procedure has a 90-day global period and covers all related services within 90 days, so this will not be paid. The procedure has a 90-day global period. The global payment covers all related procedures to the initial procedure within those 90 days, including dressing changes. Question 49. A patient calls in, upset about their bill. They say they've been billed twice for the X-ray that they received last month. You review the patient's chart and see that they have indeed been charged the same code twice, one with TC and one with 26 modifiers. Why is this? A. It's a mistake and you should submit a corrected claim right away. B. One charge is the facility charge for the X-ray. The other charge is the reading of the X-ray by the radiologist. C. This is fraud and you should report it to your supervisor. D. One charge is for the X-ray technician and one charge is for the X-ray film. B. One charge is the facility charge for the X-ray. The other charge is the reading of the X-ray by the radiologist. One charge is for the facility and the other is for the reading of the X-ray. Radiologists, MDs, are not always the ones performing the actual X-ray, which is most likely X-ray technicians employed by the hospital. Then the radiologist both performs and interprets the X-ray and there is only one charge. Question 50. What difference is there between inpatient and pro-fee coding and the way it is reimbursed? A. Pro-fee is reimbursed on a fee schedule for CPT codes and uses ICD-10 diagnosis codes. Inpatient is reimbursed by IPPS for ICD-10 CMs that are grouped as DRGs and used ICD-10 PCS. B. Pro-fee is reimbursed on a fee schedule for CPT codes and uses ICD-10 CM diagnosis codes. Inpatient is reimbursed by ICD-10 PCS and uses ICD-10 CM diagnosis codes. C. Pro-fee is reimbursed based on a fee schedule for CPT codes and uses ICD-10 PCS diagnosis codes. Inpatient is reimbursed by CPT codes by IPPS and uses ICD-10 CM diagnosis codes. D. Pro-fee is reimbursed on a fee schedule for ICD-10 CM and uses HCPCS. Inpatient is reimbursed by HCPCS by IPPS and uses ICD-10 PCS diagnosis codes. A. Pro fee is reimbursed on a fee schedule for CPT codes and uses ICD-10 CM diagnosis codes. Inpatient is reimbursed by IPPS for ICD-10 CMs that are grouped as DRGs and uses ICD-10 PCS. Professional fee visits are reimbursed on a fee schedule for each CPT code. ICD-10 CM diagnosis codes are not reimbursable in the professional setting, but are grouped as diagnosis-related groups, DRGs, in inpatient setting, and facility reimbursement is based off of DRGs. ICD-10 PCS are procedure codes used in an inpatient setting but receive no reimbursement. Thanks for watching Test.com's Medical Billing Practice Test. For complete practice, check out our Medical Billing Practice Exam with 500 questions and fully explained answers.